I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
Thank you so much, guys. I'm Dr. Joe Esposito. Thanks for being here. I really appreciate you being here. I know everybody's busy, so thanks for taking time out of your day. We're really excited. We have a special live audience tonight, and today we're going to talk about a hot topic, a question I get all the time. It's called, how do you survive the holidays by eating right? And people come to me all the time, at this time of the year, nonstop. I get emails, I get phone calls, I got patients coming in to see us, and they say, Dr. Joe, how do you do it? And I was at a party, in fact, this weekend, and people kept saying, I could never do that. I could never do that. And I said, yeah, you can do it. And the cool part about eating right is this. A lot of it is passive. You have to not do something. You have to not put the bad stuff in your body. So how hard is that? If it's passive, it's not active. And what's going to happen is, now that it's the season, people are going to start getting sick right around Halloween. Because what do? You buy candy, and you give it out to the kids, and there's leftovers. What do you do with the leftovers? Eat them. You eat them, exactly. Shouldn't, but you do. And if you're like me, what I do is, if I have something bad in my house, and I'm vegan, I don't eat any animal products at all, and one of the reasons I went vegan is because I couldn't give it, I kept giving it to temptation. So if it has animal products in it, I'm kind of like cutting myself off, which is easy. But if it's in my house, I'm going to eat it. When I was a kid, I was really fat. I can say the F word. I used to be really fat. And so I know what it's like. And temptation is there because when you eat bad foods like sugar, it stimulates a part of your brain called the nucleus accumbens. That's a part of your brain that releases dopamine. It gives you pleasure. There's other places too. But the nucleus accumbens releasing dopamine, you're getting high. So if you have candy in the house, it's going to call you, right? Joey, I'm in the pantry. Come get me. And you're going to go and eat it. And if you're like me, if you eat it all, then it's not there. I'm going to finish it, and then it won't be here, and then I won't eat it. It's bad thinking. Don't think like that. So if you have bad food in the house, rule number one is get it out of the house. Because if it's there, you're going to eat it. But what's going to happen is, watch. My predictions are always right. Right after Halloween, maybe a week and a half out, everybody's going to start getting sick. Suddenly it's flu season. It's not flu season. It's Halloween season. You got sick. And then you start getting a little better, and what comes next? Thanksgiving. Now, this is one of the worst times of the year because you're eating, A, a lot of food, and B, you're eating food you don't usually eat. Most people don't eat squash or pumpkin pie. So you put foods in your body doesn't know what to do with these things. And you create digestive enzymes in your body learns how to deal with what you're eating. And as time goes on, it gets used to this. Suddenly you're throwing something new in there, it doesn't know what to do. And also, you're going to stuff yourself silly. All right? How many people do that, right? I'm so full, I can't eat. Except for dessert. You always have room for dessert, right? So you're going to stuff yourself silly, and you know you should be eating these things. So the holidays pose a specific problem for a lot of folks. People don't know what they're going to be eating. So we want to go through a Thanksgiving dinner and discuss what's going to happen in there. Now, it's a great time to socialize. I love to socialize. I like to party. I want you to have a good time. And I want you to still avoid poisoning yourselves with all those wonderful, delicious foods out there that are going to be offered everywhere you turn around. Well, good news is there's hope. You can survive the holidays. I promise you can. So we can party, and you can party with the best of them, and still keep yourself healthy and maintain your immune system. Because one of the things that happens is you eat sugar, it weakens your immune system. And that's why everybody starts to get sick. Just because it's winter doesn't mean you're going to get sick. It means your immune system's going to go down. Several things happen. We'll talk about this a little later. Your vitamin D levels drop. You eat more sugar. You're inside more. You're not getting as much activity. These are the things that weaken the immune system. Now, it would seem to the untrained eye that there's nothing that you can eat during the upcoming months, when in reality, there's more food than any other time of the year. You just got to make the right choices. Now, you just have to consider or reconsider what you would call a main course. Because traditionally, a Thanksgiving dinner would be what? You got the turkey and the stuffings and everything else. Yeah, that's a main course. What if we just redefined what a main course is? I get asked out to dinner a lot by paraprofessionals, medical doctors, researchers, hospitals, and they want to hang out and pick the Dr. Joe brain. And it's inevitable. They want to take me to a steakhouse. You know who I am? You know who I am? You know what this is? And I laugh because I'll say, one time I went, they had a roasted cauliflower steak. And my one friend, he's a neurologist, we've become very good friends since then, neurosurgeon. And he laughs. Every time he sees me, he goes, remember the time I went to the steakhouse, you ordered cauliflower? And I was like, yeah, but I felt good. You felt awful. And it's also cheaper, by the way, too. But just the other day, I got a surprise dinner at another steakhouse. And I had Brussels sprouts and okra and something else, I can't remember. Beets. And it was spectacular. And everybody else, they brought out their meat and the lobster and everything else. And everybody's looking at my plate. That looks pretty good. I said, it is pretty good. You should try it next time. And so you can make better choices, all about better choices. So let's start with the Thanksgiving dinner. You look at the typical dinner plate. Most likely you're loaded with the things, the turkey, the stuffing, the gravy, butter, okay, or perish the thought margarine, even worse. Remember, anybody still eat margarine? I can imagine why you'd want to do that. And there's a bunch of tempting treats at the Thanksgiving dinner, and everybody tries to make so much food, and that's the thing. But look no further than the table and just start picking out the good stuff. You're going to find things like salads, green beans, maybe potatoes, broccoli, squash, lots of other tasty treats. And now if you're going to eat meat, what's my rule? Organic only. Okay, and the reason is, you got to realize that when we were kids, turkeys weren't this big. Remember that? They were like this big, okay? Something's different. Why'd it change? Well, what we're feeding the turkeys, many times they might be fed antibiotics or growth hormones, not hormones in poultry, but antibiotics which act like hormones, or we stuff them, we inject them with stuff. And that makes them bigger. It might be tastier and juicier, that doesn't mean it's better for you. So if you're going to eat meat, it's got to be organic only. So going to a party, people always ask, what am I going to be eating for the holidays? And now I'm Italian. I love to socialize, love to party. I go to parties all the time. Now, when I go to a party, here's one of my tricks. I usually bring something. You look like a hero. Oh my gosh, that's so sweet. And it's always homemade. Okay? Second thing is, I know there's at least one thing that I can eat because I brought it. So it's really good. So let's go through some tips. Okay? And then after a few minutes, I'm going to start taking questions. So if you have a question, get ready with questions. I'm going to give you tips on how to survive the holidays. Tip number 1, don't eat too much. Your stomach is only about the size of your fist. And how much are you putting in there? A lot more than that, right? Now, your stomach's a muscle, so it expands. And it can only get so big. And here's one of the problems that we have on a big meal like a Thanksgiving or buffet, is your stomach, when you put food in there, your stomach has essentially one job. And that job is to take proteins and break them into something called amino acids. Dissolves them. Then as proteins go into your small intestine, the pancreas kicks in, digests it a little further, and then the amino acids get absorbed in your small intestine. That's perfect. But the way it works is you put food in your stomach, and your stomach starts to contract. It's called peristalsis. And it mixes the food with the digestive enzymes. And it breaks it down. And then once it's broken down enough, you get a message to the brain. The brain says, okay, pass it into the small intestine. If your stomach is this big, it can't digest the food. It can't have peristalsis. So it can't mix the food. And so now the food just sits there, and essentially it rots. And there's also something we do horrible at the holidays. It's called food combining. We don't do food combining. We throw everything together at once. So if I put, let's say, I don't know, a cantaloupe, odd thing, but I put a cantaloupe in my stomach, in about 20 minutes, it's in my small intestine. It moves right along. If I eat carbohydrates and fats and proteins and volume, the stomach doesn't know what to do, and it can't mix the food. And if it can't mix the food sits there, and many times after a Thanksgiving dinner, you'll start to burp. Okay? And that could lead to something called acid reflux. How many people have acid reflux? A lot of you, of course. I know that. I've been practicing for 35 years now. And you have a sheet of muscle called the diaphragm, and in the diaphragm you have another muscle called the lower esophageal sphincter. And it's not a strong muscle. In fact, it's a really weak muscle. And so when you swallow food, it opens, food drops in, it closes, you digest food, and you pass it on. If your stomach is full, it's pushing up against the lower esophageal sphincter, and now acid can come up into your throat. So not only you're not digesting the food, the acid is coming up into the throat, and that can lead to things like irritation of the throat, chronic cough, sinus problems, and ultimately it could even lead to things like cancer. The esophagus is not designed to handle stomach acid. Following? So if you have acid reflux, that's a warning sign. It's telling you something's wrong. It's like pain. Pain is a warning sign. I don't like to cover up symptoms. I like to get to the cause of the problem. And one of the things that can activate this hiatal hernia, this acid reflux, is a big meal. And that can stretch out that lower esophageal sphincter. So I don't want you to do that. Because if you do, it can lead to long-term problems. And you feel awful anyway. So the best thing to do is really eat smaller meals. Now, I know Thanksgiving, that's a tough one, and Christmas is tough. We're going to cover that, though. Watch how much sugar you take in. This is a weird time of year. Everybody's eating sugar. And everybody brings cakes and cookies and donuts and brownies and fudge. Even in our office, patients still bring them in. And I learned a valuable lesson one day. I had this little old lady, and she came into me, and she was so sweet and so wonderful, and she brought me chocolate chip cookies. And she said, Dr. Joe, I can't thank you enough. I couldn't walk before I started to come see you. Now I can walk, and I feel better, and I have energy. My brain is clearer. I'm eating right, and I made these for you. And I said, we'll put this in the Dr. Joe is stupid list. We have the Dr. Joe's right list. This is the Dr. Joe is stupid list. And I said, what's in them? And she said, butter and eggs and fat. And I said, oh, I don't eat animal products. And her heart sunk. My heart broke watching her heart break. And I learned a valuable lesson that day. When somebody gives you a gift, you say 2 words. Thank you. That's it. Throw it away. Even when fundraisers and stuff, kids are selling cookies and stuff like that, I'll always buy it from them. I don't mind, and I'll throw it away. Kid caught me one time. Busted him. But you say thank you, you don't have to eat it. That's the nice part. No one's forcing it down your throat. So another thing is be aware of the unusual foods that you put in your body that your body isn't used to digesting. I mean, you got cranberry sauce. You can make your own cranberry sauce. Get some organic cranberries, some organic oranges, wash the skin, throw them in a food processor, throw a little sweetener like stevia, whip it up, you got cranberry sauce. Delicious. I had it last night, as a matter of fact. If you get the canned stuff, it's loaded with sugar, and worse than sugar, high fructose corn syrup. The worst of the worst. Not the worst of the worst. Artificial sweetener is worse than that. But high fructose corn syrup, and what happens is fructose is a type of sugar, and it has to be converted into something called glucose. Glucose is the fuel that your body uses. And what happens is, if you take too much fructose into the body, it creates something called uric acid. Uric acid gets in your joints, and it hurts. Now, as a chiropractor, we're pain management experts. We like to get you out of pain. So if you're eating a lot of fructose, it gets into the joints. So stay away from sugar, but especially high fructose corn syrup. All right, we have our first question. What do we have?
Hello, Dr. Joe.
Hello.
My name is Rosemary.
Hi, Rosemary.
And I have joint issues in my fingers.
Speaking of.
Yes, exactly. So I'm just wondering what the best remedy is to keep them at bay. I notice when I eat gluten products or anything like that, it inflames the joints. So what's your best recommendation?
Absolutely.
You were just talking about lessening low sugar.
Right. And even white table sugar is 50% fructose, 50% glucose. High fructose corn syrup is 55% fructose. Agave nectar, the health food, 85% fructose. It's worse than high fructose corn syrup. So don't be fooled into that, okay? So be careful about that. Now, a couple of things you asked about. Number one, gluten is a protein. We're talking about wheat gluten. There's different types of gluten. But wheat gluten is a protein, and it causes an inflammatory reaction because your body doesn't know how to digest it. So it gets into the body and causes an inflammatory reaction. That inflammation can get into all your joints. The other thing I want you to avoid is dairy products. So here's my challenge to you. 2 weeks. No wheat, no dairy, no sugars, no processed sugars. See if it helps. If you don't believe me, at the end of 2 weeks, go back and eating the way you used to. And when it starts to flare up, you'll say, Dr. Joe was right. Okay? Another question.
Thank you.
Hello, my name is Zelda, Dr. Joe.
Zelda Dr. Joe. That's amazing.
Well, anyway, my question was about a routine or possibly a health supplement that would help with memory as well as confusion.
Okay, excellent. What happens is, as we get older, several things happen to the brain. The brain doesn't work like it used to. Now, your brain runs on glucose. Remember glucose? It's good. But if you put too much glucose into the body releases something called insulin. And insulin kind of goes to the cells and opens up the cells so the sugar can go in and be utilized as fuel. If we eat too much sugar, we produce too much insulin, and then the cells say, I can't take any more insulin. I can't take any more sugar. So it says, I don't want any more sugar in my diet, and you become insulin resistant. What's another word for insulin resistance? Diabetes. Type 2 diabetes. You guys are smart. You must listen to the Dr. Joe show. Love that. So too much sugar when you're young is going to affect the brain. Absolutely. Number two, we got to make sure the brain is getting good circulation. So as we get older, something called nitric oxide drops in our body. So you can eat foods that are high in nitrates, good nitrates, that convert into nitric oxide. That might be things like beets, arugula. You know what arugula is? Ever have that? I love arugula. Arugula is way higher in nitrates than even beets. So if you have a beet and arugula salad, that can increase circulation to the brain. And that's kind of neat. Now, it also increases circulation to all parts of your body, including the romantic parts. I don't want to get blamed for anything, all right? Just saying. Dr. Joe said eat arugula. But that will help circulation as well. And then the other thing I want you to do is drink more water, because we don't get thirsty when we get older. That's one of the big problems I see as we get older. And you got to get the body in motion. So walk as much as you can. We're going to talk about that coming up, okay? Good. All right, next question.
Hi, Dr. Joe. My name is Vicki, and I love you. You've done wonderful things for me.
We love Vicki, too. Yay.
So, but I do have a question and everything, more or less about like high blood pressure and how chiropractic care can be able to like help or kind of make it go away.
Mm-hmm. Excellent question, actually, yeah. A couple of things with chiropractic care and blood pressure. First of all, blood pressure, if the blood vessels tighten, pressure goes up. So what we want to do is we want to bring down, we want to get those vessels to open up. So kind of tying into what we talked about over here, we can do things that are high in nitrates, beets, arugula, green leafy vegetables, and that's going to open up the blood vessels because the nitrates convert into nitric oxide, which opens up the blood vessels, which is awesome. Staying away from high fructose corn syrup. And this is a key with high blood pressure patients. Uric acid, remember we talked about fructose converts into glucose, creates uric acid as a waste product, gets into the joints. As another side effect of fructose, the uric acid prevents the body from properly producing nitric oxide. Okay. And so if you're eating sugar, everybody talks about salt and high blood pressure, sugar, especially the fructose, which is lowering your nitric oxide production. The other thing that happens is we talked about the stomach pushed up against the diaphragm. The nerve that controls the stomach is called the vagus nerve, V-A-G-U-S, not like Las Vegas, vagus nerve. And the vagus nerve controls all the organs except for your adrenal glands. I don't know why not the adrenal glands. Whoever put us together did that. But if the vagus nerve is being irritated, that can take you out of what's called the parasympathetic mode. There's two types of nerves in your body. I'm going somewhere with this. Parasympathetic slow you down, sympathetic speed you up. So if you're irritating the vagus nerve, it can affect the parasympathetic sympathetic function. And so when patients come in our offices, one of the things we do aside from adjusting their spine chiropractically, we can pull the stomach away from the diaphragm. Many times that puts the person in a parasympathetic mode and they relax and the blood pressure drops. So I always tell my patients, if you're seeing us as a patient, monitor your blood pressure. So I don't want it going too low. Then as a supplement, we have it on the website, drjoe.com. It's called Dr. Joe's Nitric Oxide Support. And I take that every day. But it opens up the blood vessels, and that might help as well. And the other thing is the atlas, the top bone in the neck, can move out of place. And if it moves out of place, that can pinch the nerves, like the vagus nerve, that can affect the blood pressure. And that's why so many people get amazing results with blood pressure. A lot of studies done on this with chiropractic care. We can adjust the spine. In our office, we also work on the stomach. Then we get your diet straightened out. And high blood pressure, once again, is a symptom. It's telling you something's wrong. Don't ignore it. And you can treat the symptoms, which I think you should, but my goal is always try to get to the cause as well. Make sense? Okay, another question.
Dr. Joe, thank you for having us. My name's John. I'm a chronic sufferer of sinus pressure, sinus congestion. I've tried all sorts of different treatments, potions, allergy shots, everything. Mm-hmm. Can you tell a little bit about the correlation maybe between chiropractic adjustments and relieving some of those sinus issues?
Absolutely. Yes, great question, actually, because that's a question I get all the time from my patients. What about sinuses? A couple of things we already covered. The acid reflux could be causing it. The number one food allergen is dairy. So the simplest thing you can do, and it's free, cut out your dairy. Now, when I say cut it out. Not a little bit, none. No dairy products whatsoever. And what will happen is there's a protein in dairy called casein, and casein, the body doesn't recognize it as a protein, so the immune system can attack it, and that can cause then a systemic reaction. And if the body has something in there, it has to get it out. And the quickest way the body can get something out of the system is through the mucous membranes. The sinuses, the bowels, the breath. Women sometimes have vaginal infections. So the body's getting rid of junk through the mucous membranes. So I say cut out all dairy, not even a little, because if you take a little, it kind of ruins the process. And also all wheat, like we were talking about as well. So wheat and dairy are the number one and number two food allergens. Let's cut them out and see what happens. Another thing you can try is eating more raw food. When I say raw, broccoli, cucumbers, tomatoes, avocados, salad, raw food has something in it called enzymes. And enzymes break down the food and help you digest it more efficiently. So if you're not digesting your food properly, that can affect, it goes into the small intestine, that can cause an inflammatory reaction. And I could draw you pictures on how the immune system works, but that's too much work. So cut out the wheat, cut out the dairy, and try eating something raw at every meal. And let's see how we do for 2 weeks. If it doesn't work, then we can look chiropractically. We can check the upper neck. That's the nerve supply to the sinuses. But in most cases, a dietary change is going to do dramatic improvement with sinus problems.
Thank you.
Good answer. Great. Okay, boy, you guys got a lot of questions. Next question.
Hi, Dr. Joe. My name is Hanan. I'm very fond of your show. I listen to it every week.
You're a smart woman, Hanan.
Yes. I recently was diagnosed from laryngitis to a disease called silence acid reflux.
Silent acid reflux.
And I was like, I never felt any acid. I never felt any burning, so I did not believe that.
Right.
But I'm taking medication, and I think that's what I had. So I don't eat meat. I don't eat a lot of food, and I'm not sure what's happening. What I can do, like organically, without having to take medication.
I do.
Thank you.
Big day on acid reflux today. I guess we're at the acid reflux show today. But it's so common. The number one reason we see patients in our offices, and we have in the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. The number one reason we see patients is for pain, neck pain, back pain, shoulder pain, headaches, car accident patients. We're really good at those. So patients come to us for pain. The number two reason we see patients is acid reflux. Everybody's got it. Nobody talks about it. It's really not first date conversation, is it? Hi, I'm Joe. Nice to meet you. I'm a little gassy today. It's not something you talk about. But many times, if you're not digesting your food, that the stomach can spasm and the lower esophageal sphincter can get stretched. So with the esophagitis, what you had was silent acid reflux. There were no symptoms necessarily, but you had the laryngitis because the acid was coming up into the throat. Now, many times, what we'll do is we'll put you on something like an acid blocker, a proton pump inhibitor. The problem with a lot of these medications you take for acid reflux is, number one, it can prevent you from absorbing calcium, B12, iron, and magnesium. That's not good, okay? And B12 is vital for nerve function, okay? Calcium, of course, is necessary for bone and muscle and everything else. Magnesium, most of us are deficient in magnesium. There's 3 supplements most of us are deficient in: magnesium, omega-3 fatty acids, and vitamin D. Those are the 3 supplements I think everybody should be taking, even if you have a good diet, but I digress. So if you're taking those medicines, you may not be absorbing your nutrients, and nobody ever reads the directions. Especially the men, right? We never ask for directions. That's right. So you read the directions, use them for 2 weeks, and then stop. How many people have taken them for years? A lot. And you need stomach acid. This is the kicker. I want to scream. You need stomach acid because acid helps break down the proteins. Okay, you have hydrochloric acid, which actually activates pepsin, which activates pepsinogen, which then breaks the proteins into amino acids. They go into the small intestine. The pancreas kicks in, releases more protease enzymes to break down the protein further. And if you're not breaking it down up here, it works its way down undigested or partially digested where it rots. And one of the things that happens with this is you might have rotten breath. There's 3 types of bad breath. One is like just garlic, okay, and I'm Italian, I'm used to that. I was thinking of my grandmother every time I smell it. Nanny. Second thing is you might have rotten gums or rotten teeth, and that has a certain smell to it. But if somebody has like potty breath, just smells like a toilet, that usually means the food is in their colon and it's rotten. Interesting. Okay, and when it rots, that's the bowel smell, and gases are then exchanged between in your colon, and gases get into the circulatory system. Then the circulatory system brings those gases up to the lungs, where they're exchanged again, and that's where you get that potty breath. So, all right, one more question real quick. Go ahead.
Hey, Dr. Joe, I'm Nikki.
Hi, Nikki.
Hey, my question for you is, can autoimmune diseases be reversed?
Maybe. Okay, sometimes yes, but autoimmune is the body is attacking itself. And when the body's attacking itself, you need to calm down the immune system. The regulator T cells, when they get into the body, can control the immune system. But that's kind of an advanced question. So the simple answer is this. Cut out the wheat, cut out the dairy, more raw foods. I know it sounds like the same thing we talked about. And if you're having acid reflux or heartburn, eat smaller meals. Because it's the volume. We kind of started talking about that. It's the volume of the food that can be pushing the stomach into the diaphragm. Now, with autoimmune diseases, it may take a little bit more than that. We may have to do some testing on it to figure out what we need to do to get the regulator T cells working. But in most cases, we get great results. May not go all the way better, but in many cases it does. Let me take a few more questions, okay? Do you have another question for us?
Yes. Hi, Dr. Joe. I love your show. I love you.
Thank you.
My name is Jan, and I have hypothyroidism. And I
Yes.
do take some supplements, and I do see my chiropractor 2 times a week. What else can I do to help it?
Okay, with hypothyroidism, stay with your endocrinologist, absolutely, okay? Follow what they're saying as well. But one of the things that happens, especially in our society, and I see this a lot with thyroid patients, is we don't get enough nutrients in our body to make it work, especially iodine. Now, in Japan, they eat a lot of seaweed, eat a lot of seafood, sea vegetables, and they're getting a lot of iodine in their diet. And what happens is iodine gets into the thyroid, is converted into what's called the thyroid hormones. You may have heard T1, T2, T3, and T4. Those are called the thyroid hormones. No one ever told you what the 1, 2, 3, and 4 mean. That's how many molecules of iodine are attached to the hormone. So if you don't have iodine, you're not going to be able to produce those hormones. So one of the things I'm going to suggest you do is get more iodine into your diet. We have 2 supplements that I take every day. It's called Dr. Joe's Super Greens and Dr. Joe's Essential Source. And these are supplements that have sea vegetables in them. And one of the reasons I put sea vegetables in there is because nobody gets enough iodine, especially in our society. So you got to get the iodine levels up, and you want to avoid other chemicals that are called haloids. Haloids are chlorine, fluorine, and bromine because they look like iodine, and they can block up the thyroid, and you can't absorb the iodine. So bromine, you might get in things like bread, commercial breads. They used to use iodine in bread, and they realized bromine is cheaper, and it looks like iodine, so it works very similarly. So you got to cut out the breads anyway, because it's mostly sugar and wheat anyway, but cut out all the breads, especially commercial breads, like restaurants and stuff, or fast food restaurants. Fluorine and chlorine, you might want to get yourself a whole house water filter. They're a little expensive, but you want to filter out all that water so that you can get the thyroid working again. And then you also want to stay away from wheat. Again, it's wheat, it keeps coming up, but wheat directly related to thyroid issues because it could be the body attacking itself, an autoimmune condition, and that's what we talked about, the wheat and the dairy. So cut out the wheat, try the Super Greens, the Essential Source, and get yourself a whole house water filter. Let's see what happens. Okay? Great. Another question.
Hi, Dr. Joe. My name is Jim.
Hi, Jim.
Question on I believe in other countries around the world, there's the high fructose corn syrup is a banned product, I believe.
Correct.
Do you think we'll ever see a day where it is banned here in the United States, especially with all the health awareness going on with it right now?
A girl can dream. I would love to see high fructose corn syrup taken out of our diet, absolutely. No one in the health world agrees that high fructose corn syrup is good. And the other problem is that many times it's made with genetically modified corn. And now there's a lot of debate on genetically modified foods. My approach is always this: why take the chance? So in other countries, you're not going to see a lot of high fructose corn syrup, again, because it's banned, but you don't have to eat it. The nice part is, even though it's everywhere, you don't have to eat it. You have the choice. The nice part is you decide what goes in your mouth. So you can just say, I don't do high fructose corn syrup anymore. And when you do it, you'll be very happy with that decision, because anything that has high fructose corn syrup in it is not a health food anyway. But will it be banned someday? I don't know. But you can ban it out of your life, and that's all that really matters. Okay? Okay, another question?
Yes. Hi, Dr. Joe. I'm Liz.
Hi, Liz.
Hi. I have developed tinnitus, and I've tried all kinds of supplements, and I don't know what to do to get relief.
Okay, so your ears are ringing?
Oh, it's like my brain is
Okay,
ringing.
answer them. No. Oh, no. All right, let's talk about tinnitus. That's a really good question, actually, because I see a lot of tinnitus patients. A couple of things can cause tinnitus. Number one, of course, is drugs. Aspirin can cause tinnitus. So one of the things I do when patients come in our office, we do an analysis with them, and we look at their drugs. And you can do this on yourself. If you're taking medication, look up the side effects. If tinnitus is one of them, that may have answered your question. It's pretty simple. The other thing that can happen is the atlas. Remember that atlas from way back when? That can come out of place and irritate the nerves in the ear, the auditory nerves, and that can be an issue. There also can be something inside the ear that can be going on. So I'd recommend you go see an ear, nose, and throat doctor, get the ear checked, make sure there's nothing physically going wrong. Take a look at your medication, see what's going there. And if you need to, you might want to try Dr. Joe's nitric oxide, because that opens up the blood vessels and increases circulation. Awesome. Okay, so I would try chiropractic and nitric oxide along with the other things that you can take out of your life. Okay. Fair enough?
Thank you.
Great. Another question.
Hey, Dr. Joe, my name is Melissa, and I've started taking my health back by starting an exercise program. And I'm concerned about joint damage, doing weightlifting and things like that.
Sure.
Can you recommend a program that'll help me build my muscles and protect my bones that's not going to overwork my joints?
Absolutely. And this is, we did a show on this just recently. If you go to our website, drjoe.com, we have over 1,000 hours of podcasts, audio and video. So what you do is just type in the search bar what you're looking for, and many times you're going to have, we've done hour or two shows on it. We just did one on exercise. But with exercise changes. And I keep threatening my staff, we're going to do a show called Nutrition Through the Life Cycle. As you get older, you eat different things. You need to eat different things. You're not absorbing food like you used to. You need higher nutrients As a kid, you remember, right? You used to eat a pizza and a six-pack, sleep for 2 hours, go to work. Well, not you, but you. No. You can't do that anymore. You think about it, you're tired, right? I got to go to bed thinking about that. So, yes, exercise through the life cycle is very different. And so the key to exercise is staying in motion. In fact, we did a show last week. Last week. And if you listen to that, we talked about the sacro-occipital pump and lymphatic system and a whole bunch of things there. But staying in motion is the key. So the easiest thing you can do right now is something called 10,000 steps. Get yourself a pedometer and buy a pedometer. Don't use your phone. But your phone releases electromagnetic frequencies, and that's a whole nother lecture in itself. I'm not a big fan of cell phones close to the body. So get a pedometer, and for a couple of days, just monitor how many steps you take. And most people do around 4,000, 5,000, 6,000 steps. Then you got to think to yourself, how can I get another 4,000 steps to get to 10,000? Park far away and walk. Take the stairs. Drink a lot of water. Because then what do you have to do? If you drink a lot of water, you have to got to go pee. Exactly. You can say pee. He doesn't pee, but everybody else here pees. Okay. So and then walk to the furthest bathroom if you're working. Okay, or even at home. Walk to the furthest bathroom. Find ways to get in there. And what that pedometer does, it makes you you have to pay attention to it. Now you're held responsible and accountable. So keep that pedometer on you and get to 10,000 steps. Once you're doing 10,000 steps easily, then you can start adding more to it. The big concern I have with people is they try working out too hard and too fast, they hurt themselves, and then they don't work out anymore. Okay? So if it hurts, stop now. Once you get better at it, it's good. And what you can do is, once you get good at the steps, I want you to walk as fast as you can for 20 seconds, slow down for 90 seconds. As fast as you can for 20 seconds, slow down for 90 seconds. Do that 8 times. It's called high-intensity interval training. And once you get better at it, you can add jogging to it or weightlifting. But high-intensity interval training is the best workout. You only have to do it twice a week.
Cool.
Okay? But let's get walking first.
Yes,
Fair enough? And get your diet. You can't out-exercise your fork. Remember that. You can't outrun your fork. You can't exercise and eat bad food. Exercise is only about, I'd say, 10, 15, 20% of your health. The diet is the other 80%. So that's why I like the diet part. It's easier. I don't have to do it. Okay? Okay. So, all right, let's go back to some tips here. We got a lot to cover here. All right, we said bring something to the party. And that's going to help out the host, too. You're going to look really good. So bring treats. You can bring a vegetable platter. You can bring organic vegetables, a black bean veggie dip. You can bring vegetarian pizza if you want to. You can do vegan eggnog. I like the vegan eggnog, actually. It's pretty good. You don't have to worry about getting salmonella. So, don't forget to drink your water. When you were a baby, there was a part of your brain that controlled hunger and a part of your brain that controlled thirst. And as you became a toddler, those two parts of the brain grew together. If anybody ever raised kids, remember they were little? I want to drink, I want to drink, I want to drink. Sippy cups everywhere. As you get older, you go, I didn't have anything to drink today. Aside from my coffee. Talk about that later. So, you're all in trouble. So you got to drink more water. And my rule is this, that when you pee, it should be clear, and it shouldn't have stuff floating around in it. Okay? And it shouldn't smell unless you ate asparagus. But those are some things you want to look at, and you should be peeing a lot. Now, as you get older, you don't want to drink too much toward the end of the day, because what happens? Get up all night, right? Especially us guys. So what you want to do is, I stop drinking a lot of fluids around 3 o'clock in the afternoon. And then, by the time I go to bed at 10 o'clock, I don't have to get up and pee all night. Okay? But you got to get that water in there. Because when you're hungry, remember, as a child, there's 2 parts of the brain, hunger and thirst. When they grow together, many times you can't tell the difference between when you're hungry and when you're thirsty. Most of the time, when you're hungry, you're not hungry. You're thirsty. So a neat little trick I do when I do my weight loss seminars is I want you to have a big glass of water before every meal, about 10 minutes, 10, 15 minutes before a meal. You'll eat so much less food. And that goes for the holidays, because what's happening is it's dry out. You're drying out. Your skin is drying out. You get the dry skin and everything. You got to drink more water. But a real simple trick before you go to a party is drink a big glass of water. Now, you can do sparkling water if you want to, but that's going to bloat you too. Don't forget, it has bubbles in it. That gas has to come out some way, don't forget. So, and you're at a party. Blame it on Tom. So when you go to fill your plate up, think about the food that you're putting on the plate. Is it going to make you feel good, or is it going to make you feel bad? And not just for Thanksgiving or Christmas or the holidays, every meal. Every time you put something in your mouth, think to yourself, is this going to make me feel good, or is it going to be bad? And you could say, is this something Dr. Joe would eat? Somebody said they're going to make me bracelets, WWJD. What would Joe do? So, sorry. Okay. But think about that, and what will happen is when you start paying attention to what you're putting in your body, you'll realize, I had pizza for lunch, I feel like junk. Because it's wheat and dairy, and it's heavy, and there's no enzymes in there, it's all cooked, and you're going to feel awful. So why would you put something in your body that's going to make you feel awful when all you have to do is put something in your body that's going to make you feel good? You have to eat anyway. Why don't you just eat good foods? It really is a simple thing. Make the better choice. It's all about better choices. When I go to parties, I bring something called stuffed mushrooms. My grandmother taught me how to make these. My father then showed me I make stuffed mushrooms. I don't put garlic in them because I don't want... God, Joe stinks. So, but I hate when they put garlic in food at parties because I'm a super smeller, I guess. It smells horrible. But you can do stuffed mushrooms. That's my go-to food. It's quick, it's easy, it's inexpensive. Everybody eats them. They're safe. So find your go-to food, whatever it is. I know one of my friends makes a hummus all the time, puts cilantro in it, and that's her go-to food. So people know what it is. So pick your go-to food, just bring it to every party. Nobody will know. Also, I have tons of recipes in my book. I wrote a book, I don't have a copy of it here. It's called Eating Right for the Health of It. And years ago, people said, Dr. Joe, what do you eat? So I started writing down what I ate, and I'd give out recipes to my patients and my staff, and eventually I said, you know what, I've got a book here. And that became actually my first book. Actually, I found a book. This is a funny story. I found a book on, where did we find it? Amazon, that I wrote that I forgot I wrote. One of my secretaries comes to me and says, Dr. Joe, did you write this book? I said, oh yeah, I totally forgot I wrote it. And so somebody on Amazon had it. I had to buy my own book back because I didn't have a copy of it. It was autographed. No, it wasn't autographed. But bring food to the party and ruin your appetite. Eat before you go, and then you're going to be safe. Don't focus on the food. For most people, the holidays mean, what are we going to eat? Okay? Everything is about food, 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 food. What are you going to bring? What are you going to eat? What's going to be when I get there? What can I bring? You're not going to starve. Okay? None of you, all of you here can miss a meal. I promise. You're not going to starve. So it's okay to not have everything you want at the party. I want you to focus on other things. Start new traditions. Maybe go out for a walk after dinner. Anybody been to Europe? All they ever do is walk. They walk everywhere. They're skinny too, okay? So start a new tradition. Maybe you go toss a football around after the Thanksgiving meal or something like that. The holidays should be more about spending time with your loved ones, not just how fat can I get. Fun facts. 20 minutes it takes to get the message from your stomach to your brain. This is why Thanksgiving dinner, Christmas dinner, whatever it is, you sit down, wolf all the food down as fast as you can for 20 minutes, and then you go, I feel rotten. 20 minutes to get the message from here to here. Okay? There's a hormone that's released in the stomach, and it goes up into the hypothalamus, and the hypothalamus says you're full. Okay? It's called leptin. Now, if you produce leptin in the stomach, it takes 20 minutes to get into the hypothalamus so you know you're full. So this is where I want you to consider ruining your appetite. And if you're not starving, you'll make better choices, right? Okay? So just make better choices. It's just that simple. Think about this. Average holiday dinner is about 2,000 calories. One piece of pecan pie takes an hour on a stationary bike to burn off the calories. Is it worth it? So there's pros and cons to everything. And you have to decide whether it's worth it. To me, it's not. Now, you can have a bite of pecan pie and say, wow, that's really good pecan pie. And guess what? The next bite tastes just like it. Oh, it changed. It's not going to change. Have one bite, chew it slowly, allow the spit in your mouth to mix with it, because the spit has something called amylase. Amylase helps break down the carbohydrates. And if you chew it slower, you're enjoying that sweetness even longer. So where your 5 bites might only take 1 bite if you chew it slowly to release the amylase so it tastes sweet. And it's much easier to digest too, so consider that. Don't stop moving. This is going to be so important for Thanksgiving because what do? You sit in the car, you get to somebody's house, you sit down, you watch TV, you sit down, you eat, you sit down and watch TV, and then you feel awful, but then it's dessert time. So you walk to the table. That's your exercise for the day. Get out and move. Go for a walk. Keep your body in motion. 20 minutes a day is all it takes to keep the body in motion. We talked about the pedometer, 10,000 steps is the equivalent of a 20-minute workout. Now, for Christmas, ask for one of those mini trampolines. You ever see those things? Mm-hmm. People say, I don't know what to get you. What should I get you? Get a mini trampoline. They're relatively inexpensive, and this is important because it's a great exercise that doesn't hurt your joints, was my friend who asked that question. There you go. It doesn't hurt the joints. So it's very little stress on the joints. Some of you even have handles, so you could just kind of bounce up and down. And that's a great way to start the exercise without taking stress onto the joints. Now, in your body, you have the heart, and that pumps blood, but the lymphatic system is the thing that filters out the junk. Anybody ever get sick and you got swollen glands? Those are lymph glands, and they're swollen because it's filtering out the viruses, germs, pathogens, bacteria, and they swell up. And now how are they going to get cleaned up? Muscle contraction. Every time you contract a muscle, you're pumping the lymphatic system. And if you get one of those little mini trampolines, that's flushing out the lymphatic system. So it's going to work really good on getting the immune system working too, because it's going to assist the lymphatic system. I mentioned earlier vitamin D. All of you in the winter are going to be vitamin D deficient. You either get it from the sun or you get it from supplements. That's it. And don't take vitamin D2. I want you to take vitamin D3. Because vitamin D2 is a synthetic version. And the synthetic version has to be converted into vitamin D3. Why not just take vitamin D3? And the recommended dosage is like 600 international units a day. I recommend 5,000 international units a day. On my website, drjoe.com, one of the supplements is Dr. Joe's vitamin D. 5 drops is 5,000 international units. It's the cheapest insurance policy you'll ever buy. Every time I research vitamin D, it turns out it helps the brain, it helps with cancer, it helps the immune system, it helps with bone growth. It's helping everything. Most of you, you're going to be deficient. Unless you're out in the sun with your shirt off 20 minutes in the summer, you're not going to get enough vitamin D. And most of us don't even go out in the summer anymore. So I'm going to strongly advise you take vitamin D as one of those missing supplements. Okay, really important. Got to drink a lot of water. We talked about that. In the winter, your skin's going to dry out. You got to keep your body hydrated from the inside out. To keep your body hydrated, lots of times you start to feel hungry. We talked about that. You're not really hungry. You're not really hungry. You're thirsty. So fill up on the water. You're going to feel a lot better. And then you don't have to pig out. So the easiest trick I can give you to not eat so much is just drink a lot of water. And again, I want you to ruin your appetite. Don't go to dinner parties hungry, especially if it's a buffet. Because if you're like me, you have one goal. Finish the buffet. Everything here. No leftovers. My father always said that. No leftovers. And that always sticks in my head. And every time I go to a buffet, I laugh. But when I go on a cruise, I was on a cruise a while ago, I lost 4 pounds. How do you lose weight? Because you just choose better foods. There was so much food, but you just make better choices. And guess what? It all tastes good. Turkey tastes good, I guess. I don't know. It's been 30 some odd years since I've had it. But turkey tastes good, but then so does green beans. And so does salads. And once you start to change the way you eat, you're not going to be able to go back. So just so you know. So since you're drinking water a lot, what I'm going to recommend to curb your appetite is Dr. Joe's Super Greens and Dr. Joe's Essential Source. They're 2 supplements. They're on the website, drjoe.com. Take a scoop of each. I mix it with coconut milk or almond milk. You can drink it with water if you want to. Drink it. Because again, when you're hungry, you're not hungry for food. You're hungry for nutrition. Most of us are nutrition deficient. We're not calorie deficient. Oh, no. We're nutrition deficient. And so if we give our body nutrition, we're not going to get hungry. So the easiest, simplest thing to do is give the body the nutrients that it needs. And that's why I created Super Greens and Essential Source. Quick, easy, inexpensive way to get the minimum nutrients you need every single day. So if you're going to drink a lot of water and Super Greens and Essential Source before a party, you're going to be amazed how much more fun you're going to have. Because you're not going to be standing at the food. What's there? What else can I have? What did I miss? And you know the gross factor? People talk over the food. Yuck. Another thing, if you're eating cooked foods, we talked about enzymes before, I take Dr. Joe's Digestive Enzymes. Whenever I eat a cooked meal, I take Dr. Joe's Digestive Enzymes. And it works wonders. Because as you get older, one of the things that happens is your enzyme levels drop. That's called aging. Now, we can fight Father Time by doing something like I said, raw foods, Dr. Joe's Digestive Enzymes with cooked foods. One of my secretaries, she's been with me for about 10 years now. She thought I was 16 years younger than I am. She's been with me 10 years. She got Employee of the Day. I liked Meredith. Yeah, so you don't have to do. I went to my 40-year high school reunion the other day. Oh my gosh, they looked awful. I'm looking at these people I used to play hockey with and football, going, dude. So the clock is going to tick. We're going to get older, but one of the reasons we get older is our enzyme levels drop. And we got to get those enzyme levels up. Ever been to a senior housing, a nursing home? It stinks, right? It smells like pee? It's not pee. Sometimes it's pee. But what happens is your body needs enzymes to neutralize acids and minerals to neutralize acids. And as you get older, your enzymes drop and your minerals drop. And you ever see the junk they feed them in most nursing homes is the body is trying to keep itself alive, and all this acid is building up in the body, so the body produces ammonia to try to break down to alkalize the system and prevent it from going acidic, because if you go too acidic, you die. And what you're smelling is ammonia coming out through the skin. Oh my goodness, what that is. Simple fix. Super greens, essential source, minerals, water. Simple fix. So if you have seniors in your life, make sure they're getting raw food and enzymes. Very, very important. Okay, avoid things that stress you out. I know we talked a lot about nutrition today, but be careful. Don't forget about you. You're the most important person this holiday season, because if you ain't doing good, you can't help other people do good. Okay? Too many of us take too much stuff. We got so much going on, and we don't know where to stop. It gets nuts sometimes, and everyone is usually so burnt out. And many times you find yourself feeling sad or upset during the holidays. A lot of people are going to have that. And that may bring up bad memories, which then you get caught in this cycle of, I feel rotten, so I have bad memories, which makes me feel rotten. So focus on the positives. What are some of the things that make you happy during the holidays? A little trick that I do, and if you know me, you'll laugh at this because you know it's true. I have sticky notes all over my car, my house, my office, my bedroom, because whenever something happens and I start to think about something, I want to get it out of my head. So the easiest thing to do is just write it down, and then you don't have to think about it anymore. So sometimes it's like, I got to remember, to fire Damon or something. My staff, no, Damon's here. That's why I said no. But I think about things in the middle of the night. I'm driving. Not when I'm driving. I try not to write down. But if you journal things, you're going to be amazed how much better you feel, because then you don't have to keep it in your mind anymore. And it's a really simple trick that you can do. Another thing I want you to consider is keeping your energy levels high and your brain functioning. We talked about sometimes we get depressed. And what happens is the right side of the brain controls the left side of your body. The left side of the brain controls the right side of your body. And all day, every day, we use one side of our brain. We segregate our brain. We need to integrate our brain. And there's a real simple exercise I'm going to show you right now. And you're going to love this, and you can use it for the rest of your life. It's called the cross crawl. And you integrate the brain by using the right side of the brain and the left side of the body simply by marching in place and bringing your right elbow to your left knee and your left elbow to your right knee. And now whoever you live with is going to think you're crazy, because why are you doing that? But all you got to do is this. And if you do it for 30 seconds, you will be amazed how much more energy you have, how much clearer your brain is. I know somebody had a question about brain fog, because it integrates the brain. And when you do that, it's so great. Now, Ahmad, I don't know if he's here, but he's my engineer on my radio show. And it's funny, I'll look in the window, he's behind the window, and I'll see him doing this. And I'll say, Ahmad's rebooting his brain. And it's an incredible thing that you can do. And it's great with kids. If you have kids, you want to play march around the house, it builds up their brain function. Probably the number one thing we can do for our body and our brain is a cross crawl. Right arm, left leg, left arm, right leg. Now, if you're drinking a lot of water, when you go pee, do this. You'll get fired, because you're crazy. But you'll be amazed how much better you feel. And that's going to help the brain, and especially during the holidays when we start getting stressed out, or anytime you get stressed out, do the cross crawl. It's really kind of neat. So, great success. If you want great success, it requires a little bit of work. And that's why you have to start taking some risks here and there. So what we want to do, gosh, we only have a minute left. Holy cow, how'd that happen? That's just crazy. So watch your portion sizes. Be careful with that. Eat the good foods first. Eat your fruits, vegetables, nuts, and seeds. Fill up on that. Then if you want to go back and have a bit of whatever, you're not going to be hungry. No one makes rational decisions when they're hungry, right? We've all done stupid things in the name of hunger. Okay? I don't want you doing stupid things in the name of hunger. So eat the good foods first, and then you can eat the bad foods last. Chances are you're not going to want to eat the bad food. So that's kind of neat. If you want more information, go to our website, drjoe.com. We have over 1,000 hours of podcasts there. If you have a health problem, you'd like to make an appointment to come see us, you can do that. Just go to website, drjoe.com, and you can make an appointment right there or call us. The supplements we talked about, all those are on the website as well, drjoe.com. And follow us on Facebook, follow us on Instagram. So the website, drjoe.com. I'm Dr. Joe Esposito. Thanks for being here. Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on a WSB Radio app.